Okay, good evening, everyone. Welcome to our 9th week of the LUMP CAA assessment, Certified Associate Acupuncture. We are going to have our 10th week next week. And good luck to everyone. And I'm sure you're all excited to progress to Module 2. Okay, so as usual, we will not waste so much time with introductions. Let's get down to work now. Okay, can I call on Ma'am Angel first to answer questions 1 to 5? Okay.
Good evening, Doc.
Evening.
Good evening, classmate. Number 1 po, which of the following point is level with the tip of Adam's apple on the anterior border of M. sternocleidomastoid? A. Large intestine 18. B. Stomach 5. C. Stomach 9. D. Stomach 10. And E. Ren 23. Answer po is letter C. Sa stomach 9 po.
Okay, correct answer is stomach 9. How many of you have tried needling stomach 9? I hope you still remember our AcuLift. Kung gusto mong medyo mag-lift yung neck to make that area very beautiful and at the same time calm the patient, you will have to use stomach 9, no? You just have to avoid puncturing the common carotid artery there. Okay, so as long as you know how to locate it, no, it's located. Can you see? Can you see this? Nakikita nyo?
Yes, Doc.
This is stomach 9. And what do you call this muscle po?
No.
Apple.
The
Adam's apple.
No.
Larynx.
Sternocleidomastoid.
Yeah. The
Adam's apple.
sternocleidomastoid. Cleido means clavicle. Sterno is sternum, no? So meron siyang sternal head and the clavicular head. So if you notice, did you observe the model here had to turn her neck to the right, no? So if you will needle on the left, it is safe to ask the patient to turn to the right, okay? And first, you need to palpate the muscle, okay? So try doing this. Nagiging ano talaga yung neck, no? And I'm sure everyone is good at needling already. So you have to, what's this? You have to be very careful lang po. You have to really avoid, kasi you could feel it naman kung may ugat kung may artery. There is pulsation, no? So the common carotid artery will pulsate. So you avoid that point. And when you needle this, don't needle too deeply, no? Do not puncture deeply. Perpendicular po siya, 0.3 Tsun. Okay? Para safe, you try to, do you already have the new version ng needle? That's so safe.
Yes, Doc, meron kami.
Yeah. Yung 500 pieces at 1, 2. It's so good, no? So if you're not sure about this, then don't needle it. Okay? Avoid lang talaga the area where there is pulsation. Diba? So yon. And don't needle very fast. So always make sure that the patient will turn his head to the opposite side. Okay? Very good. Number 2. Ma'am.
Number 2 po, Doc. Which of the following point is located 1 tune above the umbilicus and 2 tune lateral to Ren 9? A. Stomach 19. B. Stomach 22. C. Stomach 23. D. Stomach 20. And E. Stomach 24. The answer po sa number 2 is letter E po. Stomach 24 po ang 1 tune above umbilicus.
Okay, what do you call that point too soon lateral to the umbilicus?
Ren 9 po, Doc.
Ano po? Too
Ren
soon
9.
from the umbilicus.
Stomach number 25.
Yes. So pag aakyat ka, kasi nakalagay one soon above the umbilicus. Diba? So it would be stomach 24. Sino yung katabi na stomach? Sino yung nakaparallel kay CV12? I hope you have all studied the points at the same level. Okay? It's very easy to remember. Diba Ren 12? Ren 12, sinong tutsun away from Ren 12 is what? Baliktarin mo na lang yung 12. Stomach 21. Okay, so it's very good for rebellious stomach chi. So ang dami pong ganyan, lalo na yung mga nagkaroon ng stress, affected yung stomach. Okay, very good. Next, let's go to, so ano po ang function ng stomach 24? So it's very good for transforming the phlegm, and it can actually calm the shen, and it harmonizes your middle jaw, no? And if you have a patient with psychological issues, you use stomach 24. Okay? Use stomach 24. Okay? Yung mga may psychological issues, worry ng worry, paranoid, you use stomach 24. Okay. Perpendicular insertion, 0.8 to 1.2 soon. Next, number 3.
Number 3 po, Doc. Which of the following groups of point is level with Ren 11? A. Stomach 22 and kidney 18. B. Stomach 21 and kidney 21. C. Stomach 20 and kidney 14. D. Stomach 23 and kidney 17. And E. Stomach 19 and kidney 20. The answer po sa number 3 is stomach 22 po and kidney 18.
Okay, very easy. Yeah. Right. Remember yung kanina, katabi ng Ren 12 is 21. Too soon from Ren lateral to Ren 12 is stomach 21. So below that would be stomach 22. Okay. I hope you've also learned how to locate the kidney points. Okay. So let's talk about Ren 11. What's the difference? Like, of course, you don't need the Ren. I'm sorry. I'm sure you're very familiar with Ren 12, right? So Ren 11 is not as popular as Ren 12, but it is very effective for stimulating appetite for those who are never hungry. No? So if you have a patient na hindi ginugutom, if you want to stimulate their appetite, use Ren 11. Okay? It harmonizes your spleen and stomach. Ano pa ba? Kasi it's very near Ren 12, right? And it clears the dump for bloating. Okay? So yun. So it's 3 tsun above the umbilicus. Perpendicular insertion. Okay. What about stomach 22? So 11 times 2, 22. Gets ba? Sometimes you have to resort to all these things. Okay. Stomach, I hope you can all keep this, no, yung ating assessment, because what I have done is to actually compile everything that what a very good practitioner should know. No? I don't know if you realized it. These are very useful points. I know in a medyo you were overwhelmed with the number of points, but for your revalida, which is oral, I want it to be done face-to-face, don't worry. We will just base it on what we have asked for the assessment, no? I really want you to compile this because this is very special, okay? So let's talk about stomach 22. So for psychological issues, you use stomach 21, right? I know, stomach 2024. For,
24.
yeah. Okay, so ang stomach 22 is more about regulating the chi and also the intestines as well as benefiting urination. Okay? So wala siya masyadong ano. So again, what's the point to use if a person never gets hungry to stimulate the appetite?
10-11.
Yeah, very good.
Stomach 20.
Oo. Pero I'm sure hindi natin kailangan yun, no? Okay, what about kidney 18? Kapitbahay, no? Okay, those kidney points are actually located 0.5 soon from the midline, no? Okay, so kidney 18 and stomach 22, the same level. Okay, so this is actually the crossing point ng kidney meridian and the chong or the penetrating vessel. So it's very, very good for infertility. This can also help in constipation, abdominal pain, and also vomiting. Okay? So ang maganda lang dito is when you talk about the chong vessel penetrating, this can help a lot of women who are suffering from menstrual issues. So next, Mom Angel.
Number 4, Doc. Which of the following points is level with stomach 20? A. Rent 14. B. Rent 15. C. Kidney 21. D. Kidney 20. And E. Kidney 22. Ang ka-level po ni stomach 20 po ay si kidney 20 po.
Okay, the same number. Nalito na ba kayo? Okay.
Butang na po to, butang na.
Okay. Stomach 20. Let's talk about stomach 20. So magkapitbahay si stomach 20 and kidney 20. Okay. Stomach 20 is very good for gastric pain and also for abdominal distension. And it descends rebellious chi. Remember yung stomach 21, maganda siya for descending rebellious chi. Yung bang nag-GERD, no? GERD, yung nagre-reflux. Nako, you can also use stomach 20. Malapit lang kasi no? And higher lang ang stomach 20. Okay, and kidney 20, what is it for? It opens the chest. Now it harmonizes your middle jaw. And yeah, it's very good for vomiting. So which makes sense. So halos magkapareho lang sila ng function po ng kanyang mga kapitbahay. No? So again, kidney point, you needle 0.5 soon from the midline. And then ang stomach points, how many soon from the midline?
5.5.
No, ang stomach
Two
point.
chun. Two chun from the midline.
Very good.
Two chun.
Yes, great. Okay, Ma'am Angel, last question. Number 5.
Number 5, Doc. The point on the line fortune below the umbilicus is A. Kidney 11. B. Kidney 12. C. Stomach 27. D. Stomach 28. And E. Kidney 13. Answer po sa 5 po, yung fortune below the umbilicus po is si kidney 12 po. Ka-level po niya si CB3 po.
Okay, dito po si kidney 12. Okay. Sino si CB3? Front mo of?
Urinary bladder.
Very good. CB4?
Ano ba yan?
Front mo din ba si CB4?
Front mo na small intestine.
Okay. Tignan nyo, magkatabi pa.
Magkatabi pa.
Yung isa si SI, si bladder. They are both great young. High young. Okay. Now, kidney 12. What's so special about kidney 12? It's very good for impotence. Okay? Impotence. So you needle that. Of course, you can do perpendicular insertion. 1 to 1.5 soon. Actually, it binds the essence, no? For women, it also is very beneficial because it regulates the Ren and the Chong. So it's also very good for prolapse of the uterus. You know prolapse, yung lumalabas na yung uterus? Okay. Of course, aside from kidney 12, you have to, ang pinaka main point dyan is, anong pinaka highest point ng ano sa katawan? Do 20? Yes.
20.
Okay. Of course, you also need to do something about the spleen. Yeah. Because when you have, it's actually spleen chi deficiency. Yung spleen chi sinking ang tawag dyan. That's actually a spleen chi deficiency. Okay, thank you very much, Ma'am Angel. Let's now go to Ma'am Ami for 6 to 10. Ma'am Ami, are you ready?
Yes, Doc. Good
Very
evening,
good.
everyone. Good evening po. The point, which is the depression distal and inferior to the base of the first metatarsal bone is A. Spleen 2, B. Spleen 3, C. Spleen 4, D. Liver 3, and E. Liver 4. The answer, Doc, is letter C. Spleen 4.
Wow. Okay, very good. Are you using this point? Dito po si spleen 4, oh. Can you see it?
Doc.
Yeah. This is your metatarsal. Okay. Spleen 4, ano po siya? Anong category ni spleen 4?
A luo-connecting point of the spleen, Doc.
Ang galing. Wow. So it is very good for, we actually also combine spleen 4 with, diba? You've heard about Chong, diba? Chong Mai, yung penetrating, which can benefit menstruation, no? So sino pinapartner mo kay spleen 4?
Spleen 4 is for stomach 40.
6. Okay.
Pericardium 6 ako, yung may...
So if, of course, menstruation, babae, no? So where will you needle the spleen 4? Right or left?
Right.
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 Right. Right.
Ano, unahin niyo yung PC pala, sorry. Unahin niyo yung PC. Sorry po. PC6 sa right. Sa left, spleen 4.
Spleen 4.
Okay. So again, spleen 4 being the luo-connecting.
PC6 sa red.
It regulates the Chong Mai, no? So it can benefit menstruation, and it's also good for resolving dampness. Okay. Spleen. So magkatabi lang sila ni spleen 2. Okay. And you know what spleen 3 is, no? Okay. Good. Ma'am Ami, let's go to number 7.
Which of the following points can be used with spleen 4 to treat disorder of the stomach, heart, and chest? Letter A, stomach 36. Letter B, Ren 12. Letter C, pericardium 6. Letter D, heart 7. And letter E, Ren 17. Letter C is the answer. Pericardium 6.
So you use this kasi nga master point siya, no, ni Chong. You pair it with spleen 4, PC6 and spleen 4. And so if you use it on a woman, if you needle the woman, you use the right pericardium 6. Okay? Ano pong category si pericardium 6?
Pericardium 6.
Luo-connecting.
Luo-connecting. Luo-connecting din. Di ba very popular po si pericardium 6?
Yes.
It's very good for treating insomnia, no, and calming the Shen. We also use this for nausea and vomiting. Kaya it's very good for hyperemesis gravidarum, no? Okay, thank you. Let's go to number 8, Ma'am Ami.
The point located in center of the suprascular fossa is A, stomach 12, small intestine 12, B, small intestine 11, C, small intestine 14, D, small intestine 10, and E,
SI8.
SIB.
SI8 yan. 8 yan, 8.
SIB.
Typographical. There's no
letter A.
SIB, that's SI8.
Letter A.
Correct answer is letter
Letter A.
A. This is the picture. Suprascapular fossa. Can you see it?
Supra is scapula fossa.
Nasa center po siya ng suprascapular
Center.
fossa. And this is also, this is very good for shoulder pain. Okay? And also numbness or aching of the upper extremities. You use this po, no? You use muna your probe. It's so good. Ano po, another very popular point is SI11. Have you tried this? No. So, but the answer to the question is SI12. Crossing point po kasi siya ni small intestine, large intestine, sanjiao, and gallbladder. Number 9, Ma'am Ami.
The point located level with DO14 is A, small intestine 14, B, SI15, C, SIV, D, bladder 11, and E, none of the above. Letter B, SI15.
Okay, very good. Dito po si SI15, level po siya ni DO14, GB14. Ilang tsun po siya away from GB14? Two tsun. Very good. Nag-aral talaga si Ma'am Ami. I'm so proud. Okay, very good. Okay, you use ang function po ni SI15, it descends lung qi. It also alleviates pain. Okay? Yeah. Okay. So, too soon from DO14. And I presume, alam nyo na po. And how do you needle it? Are you going to needle perpendicular or oblique? We have to needle it obliquely. Oo, kasi baka matamaan mo yun. So, dapat, 0.5.
Delikado po.
Yes. Actually, we also use that for hemoptysis. Well, you know what is hemoptysis? You cough up blood, no? Asthma, also cough. So, DO14, naka-level siya with SI15. Next, number 10.
What point?
Hello.
Hello. What point is located between the bilateral bladder 17? A, DO8, B, DO7, C, DO5, D, DO9, letter E, none of the above.
So what's your answer?
Letter D, DO9.
Tingnan natin kung tama. This is the, very good. DO9 or GV9. Okay. Sa location pa lang po, no, di ba we use bladder 17. This is bladders. Here. Sa gitna, no? Can you see that? We use this for blood issues, no? Mga pain. So maganda din ito for pain, si GV9. Katulad ng acute gastric pain. It's also good for jaundice, pain in the chest, and hypochondrium. Okay, so it resolves damp heat. So how are you going to needle it? If you want to oblique insertion, upward.
Upward.
No? Yeah, okay, very good. So at least ni-research yung lahat, ha? Thank you very much, Ma'am Ami. You did well. Let's now call on Sir Michael. for numbers 11 to 15. Sir Michael, number 11.
Good evening, Doc. Good evening, classmates. The point level which shall one, then 10 is A, stomach 21, B, stomach 23, C, spleen 15, D, spleen 12, E, stomach 28. My answer for number 11 is letter B, stomach 23.
Sinong level ni Ren 9?
Yan, hindi ko alam sila 9.
Sinong level ni Ren 12? Ren 8? Tutsun lateral.
Ren 8 is
Stomach
25.
25.
Okay. Ilang points above ni Ren 8 si Ren 10?
2.
Okay. So what will you do?
Then 2.
Ano po? Si stomach 23. So what is stomach 23 good for?
Good for gastric pain,
Mm-hmm.
irritability, and indigestion. Yung sa nabiset ko,
Also for psychological issues.
psychological rin po. Ito lang po.
Yeah.
Psychological.
Yeah.
Okay po.
Okay, thank you very much.
Additional.
Number 12.
Ito, di ko nakuha. Number 12, stomach 9 is lateral to Adam's apple. My answer for this one is letter A, 1.5.
Did you try to measure it? Okay.
Okay.
1.5. 1.5.
Half inches, something.
Yeah. Okay, try mong i-practice yan kay Sir Albert, no? Kasi medyo...
Makikita kami, Doc, sa ano. Ito yan.
Okay. Kasama ng tawa. Okay, number 13.
Okay. Number 13, which of the following points is located above the latero-superior border of the patella? A, spleen 10, B, stomach 36, C, stomach 34, D, stomach 32, E, gallbladder 21. My answer is stomach 34, letter C.
Okay. Anong category si stomach 34?
C-clef point po.
Very good. So we don't need to explain anong C-clef point, ha? C-clef. Okay. Okay. So pag may stomach pain, or masakit yung merong mastitis or swelling of the knee joint, you need to press that stomach 34. Very sensitive. Very good. Next, let's go to 14.
Number 14. When the patient is standing erect with his hands hanging down sides, what point do the tips of the needle fingers touch? A, gallbladder 32, B, gallbladder 33, C, gallbladder 31, D, gallbladder 39, and E, gallbladder 34. My answer for this one is gallbladder 31, letter C.
Okay.
Letter C po.
Okay.
1.2 to 0.7. Perpendicular.
Okay. Actually, GB31 is an empirical point to treat what? Ano ba ibig sabihin ng empirical?
Yan, hindi ko. Yan ang
Okay.
medyo malaki.
Pag sinabi, that will be our topic next week, empirical points. Can anybody tell me ano po ibig sabihin ng empirical?
Empirical points. Dok, wala akong idea, Dok.
Diba pinadala ko na yung video, hindi niyo pinanood
Sorry po.
Parang
Ang
pinadala
dami
ko na yun Titingnan
Opo.
mo. You're not watching the videos. When you say
No.
empirical, we don't really know bakit siya naging good for that indication. No, alam niyo ba that GB31 is an empirical point to treat itching, yung nangangati. Yung nangangati. Now, we cannot explain why. Yan ang ibig sabihin ng empirical. Basta ginamit na lang siya. And it's very good for weakness and numbness and pain of the lower extremities. No? And also when you have beriberi, no? B1 deficiency. Okay.
So, kung nangangati siya or sneezy, related po ba ito sa liver? Kung,
siguro, pero oo, siguro.
Kapag nangangati,
most likely.
Yeah.
Okay, whatever. Basta 1 to 2 soon, malalim-lalim. Try nyo, no? Okay.
Okay po.
Last number for Sir Michael.
Number 15, the point midway between luo-14 in the acromion is A, stomach, small intestine 13, B, Sanjiao 15, C, gallbladder 21, D, large intestine 16, E, stomach, small intestine 12. Answer for this number is letter C, gallbladder 21.
Very good. Yes.
Nasa likod po siya, Doc. Sa may upper. Ano ba to?
Ano po ito? Ano ito yung, what's this? Anyone? Can you see my pointer?
Is transverse cervical artery.
DU14.
DU14, very good. And what is this? Naku, kababasa mo lang.
Sanjiao 14?
No, that's not a point. It's the acromion. So be familiar. It's okay.
Di ba may points yun?
Congratulations pala, Dr. Sam. Ikaw na yung sunod pala. Kasi maglilibre si Dr. Sam. Okay.
Dr. Sam, nakita tayo minsan.
Sige.
Okay. Before we ask Dr. Sam for number 16 to 20, para saan po ang GB21, Sir Michael?
GB21 is good for pain in the shoulder or back, motor impairment of the arms, and vision lactations. Mastitis to, pwede rin.
Yeah, mastitis, insufficient lactation, okay. Very good. And also for difficult labor.
Difficult labor, pwede po.
Isa-isa, press mo yan dyan. Okay, very good. Thank you very much, Sir Michael. Now let's go to Dr. Sam, who recently received his diploma.
Matagal na. Formality na lang yun, Dok. Tagal na kami natapos.
Ay, wow. Okay, punta na tayo po ng number 16, Dr. Sam.
Okay, the points of the gallbladder channel on the posterior border of the fibula are sa posterior border. So this is, hold on, tap ko muna itong tuhod ko. So this is 34. And we have GB35. GB35, hold on. Ano to?
Posterior border.
Yeah, posterior. So that is, sa likod ng fibula. So that's gonna be GB35 and 39. 1, 2, 3, 4. Yeah. Kasi 34 nasa siya eh. So that is 35 and 39.
Okay, this is GB35.
Yes,
ano
this is
classification si GB35?
GB35 is Doc. Hold on.
Sheakless din siya, no? Ng isang extraordinary vessel. So, you
Di ba
guess.
36 yung cyclip, Doc?
Iba ito sa yang linking vessel.
Okay.
Yang linking. Yang way vessel.
Yang way.
No, iba din yung CGB30. Okay. GB35 is the she cleft point of the yang way.
Yeah, okay.
The yang linking vessel. It's very good for the extension and fullness of the chest and hypochondrium, and also for weakness and pain of the lower extremities. And what about GB39?
Influential point.
GB39, yes.
Galing dito, bilang ka ng tritune.
So it is like, hold on, Doc. It's influential point.
Influential point.
GB39.
Influential point of what?
Marrow.
Yeah, the marrow.
Marrow ba?
Yeah. And if you're going to use balancing, napakaganda po niya sa pain of the neck, no? Rigidity. Di ba neck na neck yan?
Oo nga, sa balancing.
Oo, di ba?
The first method, Doc.
Yes. And I hope you still remember the balancing, ha?
Yes, Doc.
It can really, really help a lot. Especially pag nag-medical mission tayo, like we have to do balancing as well as kukunti lang needles. Okay, very good. Let's move on to number 17, Dr. Sam.
Okay, number 17, the point between the tendons of
muscle.
Muscle, tendinosus, and semimembranosus. When the knee is flexed, okay, if the knee is flexed, it's, hold on, kidney 10, no, small intestine 5, so it flex. It's liver 8, though. Letter C.
It's
okay.
kidney 10.
It's kidney 10. Sorry.
Para saan si kidney 10? Una-una, anong category ni kidney 10? Remember, nasa ano yan? Popliteal fossa. Diba? Alam naman natin pag nandyan. Anong klaseng 5-shoe point siya?
C point.
C point. Very good. So it's very good for impotence, for hernia, and also for metorrhagia. Dysuria din, no? Nahirapan umihi. Okay, very good. Okay.
Mali ako to.
Okay. Number 18.
Okay, number 18. Where do the young channels of the hands meet the young channels of the feet? So,
ano po ba yung young channels ng hands?
Young channels is large intestine, small intestine, pericardium.
Oh, young.
No, yin pala yun, sorry.
Triple warmer.
The triple heater. Yeah,
yung young channels ng paa.
In young channels ng paa, we have the
gallbladder.
Liver is yin. Hold on. Yin.
Gallbladder, urinary bladder.
Gallbladder, GB, and urinary bladder.
Saan sila nagmi-meet? Sa forehead ba? Sa face?
Sa ano, Doc? Sa face.
Okay.
It's letter B.
Nasa face po. Yan, no?
Okay. Yan po.
Sa mukha sila. Kaya nga maganda ang Aculift, di ba? Wala kayo napansin, puro mga young.
Puro young organs.
Yeah. Yeah, doon sila nagko-converge. Number 19.
So number 19 is where do the 3 yin channels of the hand meet the 3 yin channels of the foot? So that is actually very obvious sa chest, letter C.
Very easy. Andiyan, puro mga yin. Okay, let's now go to number 20.
Okay. Number 20. Where do the yin channels and the yang channels, which have an interior-exterior relationship, meet? Interior-exterior relationship meet.
Very easy.
That is letter, hold on, head, face, chest. No, kasi interior and exterior relationship is actually sa four limbs. Nasa letter E yan siya.
Okay, correct answer is letter E. Good. Okay, thank you very much, Dr. Sam, and congratulations to your long-delayed, medyo...
Blowout ako dyan sa, Doc. Blowout ako dyan sa lab.
Ay, talagang aasahan namin yan, as in.
Aasahan namin yan.
Plus,
yes,
sponsorship.
Tama ako dyan.
Ako mag-sponsor ng merienda.
Okay, let's go to Sir Leo. 21 to 25. Yan.
Okay po.
Review lang po ito.
The lung channel originates from the A, lung, B, upper jaw, C, middle jaw, D, lower jaw, and E, chest. Siyempre, Dr. Middle jaw.
Okay.
Gusto ko yan. Yung internal ng lung. Papasok yan. Dun. Yun, yan, yung middle jaw na yan. Tapos diretso yan hanggang dun sa may throat, lalabas dun sa may lung 1.
Wow, right.
Internally.
Let's go to number 22.
Number 22, which of the following channel originates in the middle jaw? Yun din yun, Doctor. So, the lung channel. Letter D.
Ulit. Di ba? Okay, so...
naman.
Masyado ng Okay. Next. Ay, saan na ba?
Yes. 23.
Okay. Wait lang ha.
Yes po.
So kung sinabi mo yung lung channel, no? So, saan nag-originate si Ren channel?
Ang alam ko po is dun sa may CV1. Dun sa may Yun, Doktor. Tinuturo ko siya. Pero dun po sa pinakababa. Pero
Yeah. Then one.
What about sa do?
Sa likod ng ng anus.
Yeah. What about kay penetrating si Chong?
Yan po, Doctor.
Kasi natandaan natin yung lung channel.
Yes. Pero yan po, pag bigyan niyo akong few more days, Doctor. Pag-aaralan ko pa yan.
Hindi niyo binasa yung notes. Okay, number 23.
The pathway of the hand-yang-ming channel does not pass through the forearm, the upper arm, C, radial side of the index finger, D, the middle side of the elbow, and E, the neck. So, ito pa, yung medial side of the elbow, letter D.
Ano pala dapat? Ito yung papalitan, di ba?
Sir. Yung hand-yang-ming po ay...
Hindi dumadaan sa medial.
Large intestine channel yun eh.
Oo.
Apa.
Yan.
Yes.
Okay. Hindi sa medial, sa lateral. Okay, very good. Number 24.
The tibial branch of the stomach channel emerges from ST36, Doctor. Letter A.
Ito.
36 point, yes. 36 point of the stomach channel.
Okay.
Diyan din nagsisimula yung internal branch niya. I think yung fourth branch na pumupunta doon sa middle toe, if I remember it right. Kasi yung stomach channel ang may pinakamadaming branches, 4.
What about yung branch? Yeah, okay, very good. Ang dami niyang branches. Ang branch ng stomach channel from the dorsum of the foot. Saan point na pumula?
42.
Wow,
Stomach number 42. Yung first branch is stomach number 5.
Ito.
Tama po ba, Doctor?
Yeah. 12 for stomach 42.
Po.
Wow. Congratulations, Sir Leo. Wow, we're almost there.
Thank you po.
Thank you very much. Sino pa ba? Oh, si Sir June Azariel. 26 to 30.
Hello po, Doc.
Hello.
26. That tibial branch of the stomach channel terminates at.
Saan siya nag-terminate?
Letter C po, the lateral side of the middle toe po.
Okay. Number 27.
The dorsum of the foot branch of the stomach channel terminates at the medial sa letter ano po, letter A po, the medial side of the big toe po.
Do you see this? Dito. Medial side. Okay. Number 28.
All of the following organs are linked with the kidney channel except the spleen po.
Okay. So lahat yan nakalink sa liver. Lahat ng organs, liver, heart, lung, and of course, kidney, nakalink sa kidney channel. Very good. The correct answer, yung except is spleen. Number 29.
The branch of the lung channel proximal to the wrist merge from lung 7 po.
Wow, memorized. Do you see this?
Yes po, Doc.
How do you pronounce the Chinese name of lung 7?
Patay.
Lieche. Parang ano? Parang medyo
Lieche.
Parang nagmumura.
May tono. Lieche. Oh, di ba?
Lieche.
Okay. So susunod na, pagdating natin sa module 3, puro Chinese na ano, para masanay mo tayo. Number 30. The channel
entering the ear is the Hanyang Tayang channel.
Ano po yan? Si bladder or si small intestine?
Small intestine.
Intestine po. Small intestine.
Good. Congratulations, Sir June. Puyat pa yan, ha? Mag-iisip kayo na maaga, magsisimba, o diba? Okay.
Thank you po, Doc.
Congratulations. And I'm very excited. Sana excited din kayo sa module 2, ha? Tatapusin lang natin yung week 10. More points and about needling technique. Okay. Now, let's call on, sino bang hindi tinatawagan? Oh, let's call on the girls. Ma'am Lynn Galarita, did you study? Hello po, Ma'am Lynn. Ma'am Lynn, can you speak a little louder? Ready po kayo? 31 to 35. Naku, walang... Madam, mukhang ano... I think may problem yung ano nyo, yung audio. Sige, balikan ko kayo ha. Pakiayos po ng audio nyo, Ma'am Lynn. Okay, pakiayos lang po, Ma'am Lynn. We'll get back to you later. Okay, let's call on Ma'am Darlene Federico. How is Okada, Ma'am Darlene? Ma'am Darlene, are you there? Busy siguro. Okay, let's call on Ma'am Lane Arandia.
Good evening po.
Okay, can you handle 31 to 35?
Number 31, which of the following channels has a branch which arises from the lung, joins the heart, and runs into the chest? A. Hand tying, B. Foot shaoyin, C. Hand tayang, D. Foot tying, E. Hand shaoyin. My answer po is letter B. Foot shaoyin.
Okay.
It is kidney channel posterior.
Yeah, very good. Yeah, that's the kidney channel. Can you see it? Okay.
Yes.
Yun na po yung partner niya sa high-yin.
Ang partner niya po is, wait lang po, Doc.
Si Han Tai-yin.
Yes.
Lang.
Foot shaoyin.
Partner ni heart. At partner ni kidney. Tai-yin. Ibig sabihin ng Tai-yin, yin na yin sila. So, may tendency sila mas malaki yung chances sila maging yang. Okay? Maliit lang yung yin. Sino ba yung I'm sorry, mali Shaoyin pala. Sorry.
Shaoyin po, Shaoyin.
Shaoyin. Diyos ko, iniisip ko si ano. Okay, Foot Tai-yin is what? Shaoyin pala, sorry. Shaoyin is the heart. Han Shaoyin is, no, Foot Shaoyin is the kidney. Han Shaoyin is?
The heart.
The heart.
Heart.
Okay.
Heart.
What about Han Taiyang?
Han Taiyang.
Small intestine po, Doc.
Okay, very good. Han Taiyin.
Han Taiyang.
Lung
channel.
Okay. Han. Okay, di bale na. Foot Taiyin.
Foot tie-in is spleen channel.
Okay. Malaking yin pala. Foot and, yeah, okay. I'm sorry about that. So next we go to number 32.
Number 32, all the following channels pass through the lung except A. Han Juyin, B. Han Shaoyin, C. Foot Juyin, D. Foot Shaoyin, E. Han Yangmin. My answer is letter A. Han Juyin, PC channel.
So, hindi dumadaan sa lung si pericard, Han Juyin, no? Okay. This is your Han Juyin. Does it pass through the lung? No. Okay. Yes. Siya dumadaan sa lung. Okay, number 33 po, Ma'am Lynn.
Number 33, the branch of the pericardium channel which links with the Sanjiao channel arises from A. PC4, B. PC5, C. PC6, D. PC7, E. PC8. My answer is letter PC8, letter E.
Ang galing. Okay. So PC8 is very good for what? Kaya nag-link siya sa Sanjiao. Like, how do you classify pericardium 8?
PC8, horary point.
Horary point.
Yes, Doc.
Okay, number 34.
Number 34, the branch of the gallbladder channel from the dorsum of the foot arises from letter A, GB40, B, GB41, C, GB42, D, GB43, and E, none of the above. My answer is letter B, GB41.
Okay. Do you remember using this for grounding the patient in Aculift? Diba? GB41. Remember, ito Yan. Okay. Number 35, the last number for you.
Number 35, the branch of the gallbladder channel from the dorsum of the foot terminates at letter A, the medial side of the big toe, B, the lateral side of the big toe, C, the hairy region of the big toe, D, the lateral side of the fourth toe, E, the medial side of the fourth toe. My answer po is letter D, the lateral side of the fourth toe.
Okay. Do you have any objection? Ano yan ha? Saan siya nagte-terminate? We're not actually talking about the, what's this? Sino pa ka-partner po ni gallbladder? Like, to whom does it link with?
BTGL. Liver.
Liver. And
Yes.
where do you find the liver? Big toe or fourth toe?
Big toe.
Okay. Is it medial side or okay? It's in the correct answer here. Saan mo po ni-research yung answer, Ma'am Annalyn? Did you check on the...
Chinek po yung gallbladder po na meridian, tapos po, dito. Nakita ko po siya doon sa, ewan ko lang kung tama yung ano ko.
Branch kasi po ito ng gallbladder channel, hindi siya yung channel mismo. No? Nagaling po sa dorsum of the foot. So nag-end po siya doon sa, di ba nauna muna si gallbladder bago maging liver? Remember? Oo, di ba gallbladder 11 p.m. to 1 a.m. Tapos punta siya sa liver. So yung branch niya from the gallbladder channel na nasa dorsum, doon siya mag-end po sa ano. Para diretso na, di ba yung big toe? Yeah, para maging liver 1. Doon mo na siya sa hairy region. Sa gitna ni...
Letter C po pala, Doc.
Yes, hairy region.
The hairies.
Okay lang po. At least, ano, yeah. Correct answer is letter C. Very good.
Po.
Thank you po. Excited
po, Doc.
for week 10. Hope to see all of you on next week.
Yes po, Doc.
Okay. Sino pa ba hindi Okay, Sir AK. Sir AK? 36 to 40.
Doc.
Good evening,
po.
sir.
Good evening po everybody.
Seryoso naman. Okay.
Medyo ano lang, Doc. Medyo pagod lang.
Oo, mukha nga. Kaya seryoso. Okay.
Session na. Apo. Number 36, which of the following channels has a branch which arises from the retroauricular region, enters the ear, then exits and passes through the preauricular region? My answer, Doc, is letter A, Puchaoyang.
Okay. That's the gallbladder.
Gallbladder, I think, yeah. Doc.
Yeah, do you see it here? Yan.
Yan. Oh,
nagaganon siya.
Paikot-ikot
okay, very
siya.
good. Correct answer is letter A. Next,
number 37. Which of the following channels does not run superiorly towards the head and the face? Heart channel, liver, chong, letter D, yin wei channel, letter E, yin kiao channel. My answer, Doc, is letter D. Yin wei channel.
Or okay, yin linking.
Yin linking channel.
Ito po si yin wei. Pumupunta ba siya sa head? Dito lang eh, oh. Kita nyo?
Hanggang sa may
dito lang.
Hanggang sa may throat lang.
So that's the yin way. All the others pumupunta sa face. Okay, number 38.
Number 38, the distance between the following pair of points is 1.5 June except Ren 6 and Ren 8. Letter B, pericardium 6 and pericardium 7. Letter C, heart 7 and heart 4. Letter D, bladder 15 and bladder 44. Letter E, bladder 16 and do 10. The answer, Doc, is pericardium 6 and 7.
So, ilang tune siya?
2 tune, Doc.
Ang galing. Yeah, congratulations. Ang gagaling talaga ng magtagal lamp. Okay. Walang mga summa cum laude. Okay. Number 39.
Number 39, the distance between the following pair of points is 0.5 June except letter A, do 15 and do 16. Heart 6 and heart 7. Letter C. Lung 8 and lung 9. Letter D, Ren 5 and Ren 6. Letter E, Ren 6 and Ren 7. Ren, my answer, Doc, is Ren 5 and Ren 6. No. I think lung 8 and lung 9. Lung 8 and lung 9, and that is
ilang tune?
One tune, Doc. One tune.
So, hindi lang siya 0.5.
Opo, Doc. Medyo mas malayo siya ng konti. Pag yun dito sa may
Okay. Let's go to number 40.
Number 40.
Mukhang stress na stress ka.
Ano lang, Doc? May week na pagod. Pero okay lang, Doc. Opo. Number 40, the distance between the following pair of points is 3 June except bladder 59, letter A, bladder 59 and bladder 60. Letter B is stomach 35 and stomach 36. Letter C, liver 5 and liver 6. Letter D is stomach 32 and stomach 33. Letter E is large intestine 5 and large intestine 6. The distance between the following pair of the points is 3 June except my answer, Doc, is letter C, liver 5 and liver 6.
So, ilang tune sila? 3 tune.
Ano lang yan, Doc, 2 tune.
Wow, memorize. Grabe. Okay. Wow, very good.
Thank you, Doc.
Congratulations, Sir AK. Pwede ka nang mag-rest.
Thank you, Doc.
Okay, we still have 20 items to go. Let's call on Ma'am SP. Nakangina pa yatang excited na sagutin yung mga tanong. Ma'am SP de la Cruz. Take care of 41 to 45. Good evening po, Ma'am SP.
Good evening, Doc Hector.
Pwede mo basahin yung question, 41?
Yes, Doc. Try ko po, Doc.
And yung sagot.
Which of the following pair of points is, which of the following pair of points is 2 yun apart? A, Sanjo 5, Sanjo 8, B, large intestine 8 and large intestine 9, Li 5 and Li 6, D, P7 and P5. The answer, Doc, is letter A, Doc. 2 feet apart.
Okay.
Sanjo 5 and Sanjo 8 po.
Ilang, yeah, that's too soon, di ba?
Too soon po. Yes, Doc.
What about Li8 to Li9? Ilang soon yan? Kita nyo to? Li9, Li8. Ilang soon yung layo?
One, two.
Yan o. Li8, Li9. Diba? One soon lang. So Li9 to Li10.
2 tune po. One tune po. Li9 po.
Li10 to Li11. 2 tune.
3 tune po.
Ha?
Li9 to Li11.
Li10 to Li11. Ito, hanggang dyan.
2 tune po, Doc.
Okay. Alam niyo ba pag may shoulder pain, we usually ask the patient, like, di ba kung ito yung likod, ito yung, papipiliin mo, ito ba or yan, yung Li12. So kung saan mas masakit, kung ito needle mo. Okay?
Li10.
What about, what's the next one? Li5 to Li6, ano po yung distance ng Li5 kay Li6?
3 tune po, Doc. Li5 to Li6.
Okay, very good. PC5 to PC7.
3 tune po.
Ang galing. And let's go now to number 42.
Sa siya nito po, babagal lang net ko.
Okay.
Which of the following pair of points is 8 tune apart? L9, L6, Li6, Li11, letter C, S36, and S40, D, spin 6, pericardium 9, REN 3, and REN 12. I think, Doc, REN 3 and REN 12.
Okay, REN 3 to REN 12. REN 3 and REN 12. Ganito po yan, no? REN 3 hanggang REN 8 is fortune. Front mo point ko ng si REN 3. Front mo ni
UB.
Okay, UB. Okay. So fortune yan. Then ito namang si REN 12 is also fortune. Okay. So all in all, 4 plus 4, 8 soon sila. What about the others? Ano bang tanong dito? Okay, si lang 9 to lang 6, ilan ang soon? Can you count it? Lang 9 to lang 6. Ilang tune ba itong yung ating, kung gusto mong putulin yan, ito, nakita mo yan?
Ano po, Doc?
Yung ating forearm, ilang tune ba yan?
12 po.
12 tune.
12 tune.
Okay. So para ma-locate mo si lang 6, Ilang tune galing kay Lang? 5.
5 tune po.
Okay, very good. Brilliant. And what about LI5? Ilang tune? 12 din, di ba?
Yes, doctor.
So si LI5, gaano kalayo siya ka LI6?
5.
Okay, very good.
5 tune.
Okay. Basta 12 tune. Okay. Ito naman, sa paa, ilang tune yung ating leg?
16.
16 do.
16. Okay. So para ma-locate mo si stomach 40, anong gagawin mo kung hindi mo ma-locate? Like ano yung pinakamadali? Kunin mo yung gitna.
Sa likod po ng ano do. Sa stomach 40 sa likod po.
Okay. So kung nakikita nyo, malayo-layo siya konti si stomach 40, no? 1 finger breadth, the middle finger. Okay. This is spleen 9. 3, 6, 9. Ang gagaling nyo na, grabe. Okay, let's go to number 43.
All the following points are located 3 tune above the transverse crease of the wrist except LI6, A, B, SI7, C, sagittal 6, D, sagittal 7, E, pericardium 5. I think SI7.
So ilang tune po siya galing sa transverse crease?
5 tune po.
Galing. Diba? Yan po. Yan. So lahat ng iba, puro 3 tune. LI6, Tanjao 6, SJ7. Actually, magkatabi lang si SJ6 pati SJ7, di ba? 3 tune lang. And then pericardium 5. Okay, except for SI7. Yeah. Now let's go to number 44, Ma'am SP.
The triggering channel of the hand are commonly indicated in A, mental illness, B, disorder of the heart, C, disorder of the stomach, D, disorder of the chest, E, none of the above. I think disorder of the chest.
Wow, congratulations. Correct answer is disorder of the chest. Diba natanong? Okay, sa chest. And number 45, yung mga yang naman ng hand. Para saan po? Tulad ni LI. Number 45, Ma'am S.
The triggering channel of the hand are commonly indicated in A, disorder of the forehead, face, and nose, B, disorder of the mouth and teeth, C, disorder of the eye, throat, and febrile diseases, D, disorder of the ear, E, none of the above. Disorder of the eye, throat, and febrile diseases.
Okay, correct answer is C. Congratulations, Ma'am SP. You did well. Mukhang pagod na pagod kayo. Okay. Sino pa ba? Okay, pwede na natin tawagan si Ma'am Lynn. Ma'am Lynn, naayos yun na po yung audio nyo. Ma'am Lynn? Ako. Pakisagot na lang po, paki-write na lang ng answer sa group chat. Okay lang? Oo. Or magsa-sign language kayo, si Sir Jun ang magbabasa.
Hello?
Kasi wala kayong boses, Ma'am Lynn. O sige, isulat nyo na lang po sa ano. Okay, ang hirap. O mukhang si Dr. Sam mukhang magaling sa sign language. Bakit po ganyan yung audio niyo, Ma'am Lynn?
Alisin yung ano niya, Doc, yung headset.
Ay, oo nga pala. Tanggalin niyo po yung headset niyo. Mukhang hindi siya, hindi siya friend. Yan.
Naririnig
Oh,
niyo po?
yes.
Yan.
Bakit kayo nawala yung...
Kaso ang hina po eh.
Ay, okay na. Malakas na po yung boses nyo. At least kapag na-relieve si
Hindi ko
Sir
marinig.
Ay, hindi nyo marinig. Ay, naku, ano ka pala talaga?
Naririnig niyo na po?
Opo, pero kami hindi nyo marinig.
Ano?
Andiyan po si Sir June para sa sign language.
Naririnig ko na po.
Ah, okay. Very good.
Hindi niyo pa rin ako marinig?
Okay na po. Okay na. Clear na po. Sabi nyo kasi kanina, hindi kami marinig. Okay. Please take care, Ma'am Lynn, of numbers 46 to number 50. And I presume ready po kayo. Okay. Can you read the question po? Number 46.
Okay. Number 46. Which of the following points is located 2 tune below LI11? A, LI6, B, LI7, C, LI8, D, LI9, E, LI10. It's LI10 po, letter E.
Okay, very good. This is very, very effective for shoulder pain. As in, pag need, i-press nyo muna kung super sakit. Ako pinapapili ko between LI12 and LI11, LI10. Yeah. Okay. Ito po, the correct answer is LI10. Let's go to number 47.
Number 47. All the following points are on the line joining LI5 and LI11 except A, LI7, B, LI10, C, LI12, D, LI8, E, LI6. C, LI12 po. Lampas na siya sa 11 eh.
Oo nga eh. Masyadong stupid itong question, no? Masyadong pambong. Maraming salamat po. Congratulations. Let's go to number 48. O, ito napaka-importante po nito.
Okay. Number 48. The point which has the function of dispersing wind, removing heat, and benefiting the eye is A, UB1, B, LI11, C, Sanjao 17, D, Do 23, and E, GB20. My answer is GB20.
Okay. Correct answer is GB20. Feng Shui. Feng Shui. Parang, yeah, parang ano, kalahati ng sure. Feng Shui. Feng Shui. That's wind, no? Okay. Number 49 po, Ma'am.
49. Which of the following channels has the most branches? Letter A, bladder channel, B, stomach channel, C, gallbladder channel, letter D, liver channel, and letter E, Sanjao channel. Nabanggit na po kanina nung kalimutan ko kung sino siya. Stomach channel po.
Hindi siya dapat kalimutan. Memorize sa lahat ng channels, mga branches.
Nabanggit kanina ng isang classmate
Leo,
na
most branches. Di ba meron tayong question kanina niya kung saan-saan saan lumalabas. Okay, thank you po. Number 50.
Number 50. Which channel originates from the nose? Letter A, stomach channel, B, spleen channel, C, bladder channel, letter D, gallbladder channel, letter E, none of the above. Letter A po, stomach channel.
Okay, tinangan natin kung talagang sa nose nang galing.
So, siya pumunta sa malapit sa mechanics mula sa gilid ng ilong.
Gilid ng ilong. Oo. Di ba pag galing sa LI, diretso sa stomach. Very good, Ma'am Lynn. Thank you very much. Alam na natin sekreto paano hindi tayo magsa-sign language. Ma'am Lynn, are you happy with the way we're learning?
Oh, yes. Marami po ako natututunan.
Hindi ba kayo na-overwhelm? Yung iba pang ramdam ko talaga.
Medyo lang. Kasi habol lang ako eh. Pero I'll try to keep up.
Anyway, you can always go back to... were all the modules emailed to you from weeks 1 to 9?
Mga ano lang, dinownload ko po sa YouTube yung mga webinars and
Aside
videos.
from that po, meron po tayong pinapadala na
mga PDF, parang day 1 lang ang meron ako or day 1 day.
Hindi ba pinapadala sa inyo via email?
Hindi po na kumpletong padala ni
Ay,
dalawa lang days ang napadala niya.
Ganon? O sige. Kasi kompleto na po. Ganito na lang. Pagkatapos ng 10, kasi ginagawa ko pala, sinasabay ko week 1 and 2, lahat na andoon. Then 3 and 4, 5 and 6, 7, 8, 9. So, bali 5 sets, no? So, sige din po. Kahit hindi naman kayo hinahirapan mag-catch up.
Hindi naman masyado.
Ay,
pero gusto talagang makahabol kasi sayang na.
Sana po walang mag-miss ng module 2 ha. Pwede nang kahit hindi masyadong nakahabol, hindi natapos yung module 1. I really insist that you really catch up sa module 2 because module 2 is the talaga, as in it's pag nalapasan yung module 2, doon yung masasabi ang ganda pala ng acupuncture, no? So, i-exhaust din natin yung ating, of course, I cannot expect all of you to be very good at kaagad, pero ang ko lang, pakiusap ko lang talaga, you have to see patients on a regular basis, no? You can start with your family, with yourself, because the diagnostic is actually one of my favorites because pag hindi po maganda yung ating diagnosis, I think hindi tayo makaka-arrive at the pattern, diba? Pattern weaving is what will set us apart from the others, no? Pattern weaving is so important. Doon mo talaga malalaman kung malalim yung knowledge niya. Hindi mo maiintindihan si pattern weaving or pattern differentiation if you haven't really mastered Module 1 and Module 2. Okay? So kahit humabol po kayo sa Module 2, you can always go back to Module 1. No? But for Module 2, this is where we get to discuss talaga, like we make use of all of our senses. We will teach you how to interview patients, what to ask questions, what questions to ask, based on what you see on the face, based on what you see with your eyes, no? You need to really know the element. Lahat naman ng elements natin nandyan eh. Naka-rank lang sila. Yung pinakabulok na rank, pinakamababa, yung lumalabas na imbalance mo. Yung medyo natitira mo pang nasa number 1, yun yung parang wala pang problema. So, I hope you can share the same passion. Share ko lang po sa inyo ha, yung may kausap po ako kanina na nag-join po sa LAM. I haven't met him personally, but according to him, I think he stayed in China or Hong Kong for 20 years. And nagustuhan niya yung program natin. And pinamemorize daw siya ng teacher niya kung paano po maging successful dito, no? Sabi ko sa kanya, kasi sa kanya gusto ko na mag-retire. Sabi niya, hindi ka dapat mag-retire. So, hindi naman ako completely nag-retire. I still have to see patients, no? Ito po yung tatlo, ha? Magbe-break lang tayo. Anyway, we have 10 questions left, no? The first one is, you should have a never-ending passion for furthering your knowledge of Chinese medicine, no? Yon. Unending passion. So, ibig sabihin, hindi dapat mawala yan. Paano kung magkakaroon ng passion kung hindi ka masyadong nahasa sa basics? No? Diba? Kaya, I really, really want to congratulate all of you for staying on. Imagine, this is already our 9th week. And next week will be your last week for Module 1. And parang sa tingin ko, papasa kayo kahit sa Revalida eh. Kausapin ko na lang kaya si Sir Mukhang wala ako pwedeng maitanong. Parang feeling ko talaga ang gagaling nyo na. I'll see, no? Anyway, after next week, we will immediately proceed to module 2, which is diagnostics. Okay, so did you get that? Number 1, never-ending passion for furthering your knowledge of Chinese medicine. No? Number 2, never seek for fame, fortune, or power. No? Hindi po dapat natin hangarin na maging famous, yumaman, or magkaroon ng power. Yun.
Yeah.
And number 3, do not refuse treatment to anyone. Alam niyo ba, pag hindi naman kaya nung mabawiin mo na lang sa iba yung mga galing. Oo. So, you should always treat everyone. Alam niyo ba, I also do free dito, no? Like, I give free trainings sometimes, or I think twice a month. And I could see the blessings pouring in. And yun lang, do not expect too much. And it's really a challenge. So I hope if you really appreciated what we are doing, we hope you can share the same objectives, no? Yung kasikatan that will just come, the fortune or even the power, no? Let's just increase our number para magkakaalaman na, no? I'm saying this to actually inspire all of you, because our goal is really to make doctors or all those in the healthcare profession to actually listen to us. And I'd like to congratulate yung mga pumunta ng Occidental Mindoro, no? Headed by Sir June. Sayang, no? And I was told parang inimbitahan kayo ulit. And you were asked to, siguro if Dr. Palanca was still alive now, she would have been very proud of all of you. And dito nyo nakita yung value talaga ng, yung pinagagawa natin, no? And yun. Okay, so we hope we can see each other for the actual medical missions. And I'm sure even though we're not around, you can do it. Practice, 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 and remember the 3 goals. Okay? So yun. And also, I would like to reiterate that the questions that we are asking, that we are using in our assessment, are actually the things that all of us should know. No? Parang add-on na lang po yung mga, I'm sure not all of you would have the time to watch all of the videos. More than 2 hours na nga yung iba, di ba? And do you like the notes? Have you read all the Are you happy with all the materials that we have been giving you? Yes?
Okay, Doc. Yes, Doc. Maganda, Doc.
Did you read all of them?
Di kaya.
Did you scan all of them?
Yes, Doc. Kahit pa paano, Doc.
Sinistik up po, Doctor. We're still reading.
No. We cannot expect you to be reading all of those. I doubt if you ever, if you ever watch the video. But I'm sure some of you do. Ano nyo lang talaga, i-compile nyo lang talaga, no? So wait for our, I hope to be able to give everything by Tuesday para maaga tayo and congratulations sa lahat. Okay, hindi pa tayo tapos. We still have 10 questions.
Doctor.
I think everyone has, and I'm sure ready na si Ma'am Angel. Can we go back to Ma'am Angel? Ma'am Angel, number 51 to 55.
Well, the house of the mind is...
Number 51. The point, heart 8 and pericardium 8 are commonly used together to A. House the mind. B. Clear the fire of the heart. C. Regulate the chi of the liver. D. Cure night sweating. E. Dredge the channels and collaterals. Answer po sa number 51 is letter A po, house the mind po. House the shen. No. Clear the fire of the heart.
Clear the fire.
Okay. what points? So kung hindi po how's the mind ang sagot, so it's clear the fire of the heart, no? Kasi these are, ano ba tawag dito? These are yin spring, right? Yin spring ba? Yeah.
Yin spring points.
Yin spring. So ano po yung points that can house the mind? When you say house the mind, to provide residence for the mind, for the Shen. Alam nyo ba, if you have yin deficiency, it will start as blood deficiency. Okay? So blood deficiency, uncorrected, will lead to yin deficiency. Kapag kulang ka sa yin, this will not provide residence for the Shen. So your mind will be restless. Diba? Hindi ka makatulog. And your sleep is dream disturbed. So yun. So we're looking at a deficiency condition. So we use heart 7. No? Heart 7, PC7. But this one is different. This is more of excess. No? Fire siya eh. No? Fire siya. Remember, malapit na siya sa dulo, right? Remember the 5 shoe? Yeah. So yun. Clear the fire of the heart. So correct answer is letter B. Congratulations. Number 52, Ma'am Angel, please.
Number 52 po, Doc. Which of the following points has the property of regulating the heart rate? A. Stomach 36. B. Pericardium 6. C. LI4. Large intestine 4. D. REN 14. E. Heart 7. Answer po is pericardium 6 po, Doc. Luo-connecting point.
Yeah, very common to, di ba? Yeah, luo-connecting. Ang galing. Ganyan dapat talaga tayo, no? Yeah, meron pa tayong mga points yata kulang, yung mga ghost points pa, yung reviving the young, Madan Young, heaven, yun. Hindi ko mga masyadong ano pa iba, but anyway. Are you excited so far? Ang dami na nating alam points. Ulitin pa natin ulit yan, ha? Okay, go. So the correct answer is pericardium 6.
Oh,
yeah, this is very effective, pericardium 6. It actually facilitates the flow of the qi. So it regulates the heart rate. Number 53.
Number 53 po. Which of the following point is the most appropriate to treat hernia? A. Kidney 1. B. Spleen 1. C. Liver 1. D. Gallbladder 44. And E. Urinary bladder 67. Answer po sa 53 is liver 1 po. Jingwell point.
Yeah, Jingwell. Very good. See, liver 1 is also good for epilepsy, for enuresis, yung bedwetting. So Jingwell po siya. Very good. So we use that for hernia. No? This is liver 1. How do you needle liver 1? Are you going to needle deeply?
No, Doc. 0.3.
Yeah. No, 0.1 lang. 0.2. Ang sakit niya kaya. 0.1.
0.1 tune.
Parang prick lang. If you have that, yung
yes.
Pang diabetes, yung Lancet, yeah. Yun lang. Okay, umaakyat. Okay, I'm sure you know what hernia is, no? Okay. Yes. We will also deal with that during the clinics, no? Yung ating module 5, yeah. Okay, number 54, Ma'am Angel.
Number 54. What action would it produce when REN 23 and kidney 6 are stimulated simultaneously? A. Relieving anxiety. B. Promoting circulation of blood and qi and relaxing muscle and tendons. C. Subduing endogenous wind and relieving phlegm. D. Regulating the function of the stomach to stop vomiting. E. Promoting secretion of body fluid to relieve thirst. Answer po sa 54 is promoting secretion of body fluid to relieve thirst.
Okay, anong classification ni kidney 6? Actually, kidney 6 is very good.
Shaoyan po.
Yeah, it's a very good point for the yin, for nourishing the yin. Diba? So, syempre, and REN 23, it's, di ba nasa throat yan, no? So, i-combine nyo talaga REN 23 and kidney 6. Okay? They should be stimulated simultaneously. Paano kaya yun? Ay, madali lang, nakahiga yung patient. Okay. Can you do it?
Electro daw.
Kidney. Yeah, electro. Very good. Brilliant! Ang galing nyo na talaga, grabe. Okay. Number 55. Ma'am Angel, the last one for you.
Number 55 po, a prescription containing the point DO14 and urinary bladder 12 and lung 11 has an action of A. Tonifying the yin of the lung. B. Activating the dispersing function of the lung to relieve the exterior symptoms. C. Eliminating wind and soothing asthma. D. Activating the function of the stomach and the spleen. E. None of the above. Answer po is letter B po, activating the dispersing function of the lung to relieve the exterior symptoms.
Okay. So I hope that's very clear, no? Do 14, bladder 12. Basta phone, that's for the wind, exterior. And lung 11. Okay? Maraming salamat po. Congratulations, Ma'am Angel.
Thank you po.
And I think we are now on our last 5 questions. Congratulations, everyone. Okay lang ba kung tawagan ko ulit si Ma'am Ami? Finale natin, 56 to 60.
Each of the following channel passes the lung organ except A. Han-Jian channel, B. Han-Shaoyang channel, C. the Put-Jian channel, D. Put-Shaoyin channel, and E. the Han-Jiangmin channel. My answer, Doc, is letter A, the Han-Juan channel, or the pericardium.
Yeah, napansin nyo pa ulit-ulit, no?
Yes, Doc.
It does not pass the lung organ. The
pericardium.
Pericardium, yes. Number 57.
Each of the following organs has connection to the course of the kidney channel, except A, the liver, B, the heart, C, the spleen, D, the lung, and E, the kidney. Letter D, Doc, the lung.
Imposible hindi nyo natin tumatandaan, no? Okay, giveaway na. Number 58.
The channel connecting either the external or internal canthus include each of the following except A, the Taiyang Lung channel, B, Shaoyang Sanjiao channel, C, Yangmin large intestine channel, D, Yangmin stomach channel, and E, the Shaoyang gallbladder channel. Letter C, Doc, the Yangmin large intestine channel.
Okay. Okay. Letter C, yung except.
Yes.
Okay. Number 59.
An exterior syndrome can be differentiated by the presence of A, tidal fever, B, high fever with aversions to heat, C, alternating chills and fever, D, chills and fever, E, chills without fever. Answer, Doc, is letter D, chills and fever.
Okay. This is very important, ha? Kaya I implore all of you to attend our 8 to 9 p.m. Mondays to Wednesdays. Di ba si Sir Dino? this is to facilitate your pattern differentiation. This is very important. Puro exterior syndrome yung ating dinidiscuss, no? So if you notice, meron tayong iba-iba po yan, no? So yung sagot is letter D, simultaneous ang chills and fever. You need to understand bakit may chills, bakit may fever at the same time. And it's different kung alternating chills and fever. And then this all corresponds to the 6 stages, 4 levels, no? Those things you have to really know. Okay? So yon, Monday, Tuesday, Wednesday. Okay lang kahit hindi kayo maka-attend, you can always watch it anytime. Okay, finally, nasa last question na po tayo. Number 60, Ma'am Ami, please.
An exterior deficiency syndrome can be differentiated by the presence of A. Chills, B. Fever, C. Sweating, D. Thin tongue coating, and E. Superficial falls. Letter C, Doc, sweating.
Okay. Alam niyo ba kung bakit nagkaka-sweating? Bakit kung wind cold, walang sweat? No? So you need to know these things. Siyempre pag deficient siya, hindi mo masara yung skin pores. And this is something to do with a Wei Qi deficiency. Okay? So all these things we need to study. So congratulations, everyone. Thank you very much for joining. Do you have any questions?
None, Doctor.
Okay. Is everything clear so far? Excited
Yes,
na ba kayo? Saan na ba tayo? Like, this is week 9, so we're going to end next week. Is it okay if...
Sorry.
Actually, sanayan lang talaga, no? You just have to get used to... Did you notice the questions keep... The person na nag-ano siya, bumabalik-balik, di ba?
Umiikot-ikot lang.
Paikot-ikot. Hanggang sa...
Na-memorize na namin.
So, are you all excited about next week?
Yes, Doc.
Yeah,
ano yan, Doc? Week 10, that is the last module for the first.
For module 1, yeah. And I know, because I know you're all good, we can immediately proceed to module 2.
Kailangan magbayad na ako, Doc.
Hindi ako in charge yan na. Yung bakit wala si Sir Albert? Okay. Anyway, thank you very much for, I hope, nakatulong ba so far? Is the assessment worth it?
Yes, Doc.
Yung mga e-books pa lang ha, those are like, even the notes, do you get the time to really take a look? They're all precious, no? So for module 2, we're going to talk about, of course, mastery of the tongue and pulse. So hindi po pwedeng hindi tayo magkita kasi iba po talaga ang actual, unlike the basic. So I think if not June, maybe July, we will schedule a face-to-face. And I want to see how you needle. I'd like to see how you see patients. Yun. Ano pa ba? Like we have to do palpation, we have to do observation, everything. Mastery of the 5 elements is important. And we have to already incorporate some mga points. Module 3 is about pattern weaving, pattern differentiation. No? Dito mo na talaga integrate lahat ng mga natutunan from the basics to, and it's really fun, no? Of course, we will have to do it like, but it's going to be easy if you put in a lot of effort in mastering modules 1 and 2. Okay, so we hope that you will continue to be. Ang bilis lang, no? We're now week 9. So,
yes, no.
Walang kahapon lang. So, tuloy-tuloy lang po tayo. We still have to meet next week, Friday. And I'm not so sure about the Revalida. I'll probably do it face-to-face. And malalaman ko naman yan no? If you're really good. I think when we do the practicum at the same time. Sa tingin ko naman, ang gagaling yun na. Like, where are you now? Like, tanungin natin sino ba hindi ko pa nakakaul. Oh, Sir Michael. From 1 to 10, asaan ka na?
So ako po, nasa range 1 to 10, mga 7 po, Doc.
Wow, grabe.
7 po. Ano naman po, Doc sa akin po, good po naman po ako sa research. So, doon po ako forte ko sa research. So, ang ano ko lang po talaga, Doc, is more on implications. So, wala akong time to apply kasi, of course, I'm working and medyo busy po talaga ako sa work. Pero I'm trying my best na incorporate ko rin yung aking forte, which is the research. So, inaano ko po talaga yan. Ang problema rin sa akin po yung memorization. So, I need to be sama ko yung lahat ng aking kakayahan para may pasok sa utak to. Pero kailangan talaga pong a lot of time to memorization ng mga points.
No, actually, you don't memorize the points because you will be, of course, I understand. Hindi naman ma-memorize siya, no? However, if we talk about it most of the time, especially, alam niyo ba yung diagnostics? When we do diagnostics, you also think of the points already. And
Yes.
think of the points in terms of their categories, diba? So yung ganun. So parang, paulit-ulit, no? Like GB31, mga GB39, mga GB35, yung mga less commonly used. These are the things that you have to, you will get to encounter. So next week, I'll see you all again. Is everybody happy and excited? Thank you very much, Sir Michael, for finding time. So sana tuloy-tuloy. Huwag kayong mapagod kasi focus lang tayo. Kasi pag natapos natin itong Module 1, napakadali na po ng Module 2. And we should prove to everyone that we are all good. Okay.
Doc, may question ako, Doc. May question ko related sa mga bagong estudyante. Kung pwede siyang isabay sa Module 2 o they will start in Module 1?
Napakahirap naman sagutin niya.
O nga po, Doc siyempre may mga interesado din. Kaya sabi ko, hindi ko ma-sure kasi nasa Module 2 na kami. So I don't know if they can come up na
I don't know if sa tingin mo ba malalaman nila yung 10 weeks in one sitting?
No po. Imposible po, Doc.
Like di ba? Like do you think punta mo na, let's talk about Module 1 first. Let's say nakapasok ka week 7. Do you think you can understand week 7 without week 2?
Parang mahirap daw. Mahirap
daw.
So did that answer your question?
Yun lang po lang.
Pwede nyo naman sila turuan. Kasi ang hirap kasi, like, I don't believe kasi in, of course, meron tayong, this is not really memorizing. We didn't ask you to memorize all the points in the channel. Yung atin lang is kinategorize natin yung mga points.
Yes po, yes.
Ang pinaka-importante dito is your clinical ability, your clinical acumen. No? Yung may ano ka na, you already have a working diagnosis the moment you see a patient, no?
Yeah.
Nakita mo may edad na, tapos ang payat-payat, mapula yung pisngi, yung mga ganun ba? Automatic yun. So kung malaki yung tiyan na dumating, tapos pag lumalakad ang bigat-bigat, yun. No, di ba? And so, alam mo na kaagad what to expect even before looking at the tongue.
Yeah, okay?
So, I cannot really answer that. Kasi, in my case, it's not that fast.
Yes po. Opo.
No shortcut.
Natanong lang po kasi sa akin, sa mga lecturer din po kasi ng TESDA, yung nag-question sa akin, kung pwede nga daw mag-join. Sabi ko, I'm not sure kasi magsimula na nga po tayo ng Module 1. And sinabi ko rin po, not all na in detail, pero mukhang mahihirapan ka. Pero siya po, nagpa-practice na rin po siya ng therapy sa TESDA. Nagde-lecture po rin siya ng mga shiatsu, mga ganon. So, related din naman po sa mga points, pero yung acupuncture per se, hindi pa siya ganon.
Try mo lang siyang, pero syempre dapat may module 1 din siya. Pero tingnan natin, no? Let's try module 2. Kasi with module 2, i-review nyo rin yung module 1 eh.
Opo.
Kailangan may foundation siya.
Paulit-ulit lang.
May TCM foundation.
Yeah, foundations. Yeah. Okay, lahat kasi foundation. So did you appreciate all the e-books that we gave you?
Opo naman, Doc.
Yes, Doc.
Yes, Doc.
Yeah, very good.
Yes po.
Sana po may time kayo mag-attend if you have no patients, 8 to 9 every day. Like, I plan to, yung matututunan natin 8 to 9 p.m., Mondays, Tuesday, Wednesday. Pang module, na yun module 4. So, if we can actually learn. Ginawa ko siyang very detailed. In fact, we have YouTube videos on that. Although mas maganda kasi like we discuss it on especially sa tongue. I plan to, alam nyo, let me be honest with you, you cannot master tongue diagnosis if you will not study it every day for 2 years, no? So let's start somewhere. I came up with a technique that will make you really fall in love with tongue diagnosis. Hindi mo kasi ma-appreciate yung tongue kung medyo yung shortcut lang yung kaalaman mo with But anyway, I am developing a program that will appeal to both beginners and practitioners alike, no? It's a challenge, pero I hope, like if you notice, meron tayong common cold and influenza.
Yes,
yung kasi. So I hope you can watch that. And inuulit natin sa 8 to 9 p.m. Although iba yung nagmo-moderate, but I feel na, and then I plan to have like diagnostics na at the same time. Yung top. Because this will set you apart from the others. No? If walang tongue, it's just like going to a doctor na piniscribean ka lang ng gamot, hindi tiningnan yung, hindi ka man ang check up. No? So let's start the trend. If you did not train with lump, then you don't know. If you don't do tongue diagnosis, then definitely you are not with lump. No? So let's prove to everyone that we're really good. And tiyaga lang talaga. And I would like to thank Sir Mahin. Sir Mahin pala yung pronunciation mo, sir. Hindi niyo ako kinorek, no? I just heard your name mentioned by Sir Albert. Oo, Mahin pala. Isa yung mga But anyway, excited po ako, Sir Mahin, for September 9. We already put that in our for the information of everyone, si Sir Mahin is in charge of the entire Negros province for the wellness program. Plano namin is to make Negros the wellness capital of the Philippines.
Wow! Diyan naman ako dyan, Doc.
Oo.
Sir, kailan tayo punta doon?
Pwede. Meron kaming pinaplano for next year. Mamaya na lang namin sabihin pag malapit na. So, just inform your team, Sir Mahin. I really love doing what I'm doing. Kahit and kahit ang dami-dami niyo binibigay na prutas, pati kamote. Hindi ko pa naubos yung kamote eh. Wag na lang masyadong magbigay kasi hindi ko rin mauubos. But anyway, I appreciate it. We hope na we can, although mas focused ako sa yung mental health, ang dami po kasing may konting diba? Okay, so maraming salamat po. Any questions? Sir AK, do you have any question?
No, Doc, okay lang. Wala po. Wala
Okay.
pong tanong, Doc.
Thank you po. And
Thank you, Doc.
Sir Leo?
Sir, pwede bang out of topic? Sir, may narinig lang po ako about P syndrome.
Yeah, that's P. P
Yes.
syndrome. Yeah.
Sir,
It's,
can you tell us more
elaborate.
about this?
Okay, P syndrome is actually painful obstruction syndrome. This is about like bakit ganun pa rin eh. When you say P syndrome, a very good example would be rheumatoid arthritis. Yung mga may mga pain na mga shoulder pain. So it can be due to heat, cold, dampness, wind, no? So if yung pain mo, yung painful obstruction syndrome mo is cold P, cold, nawawala yung, it's actually matindi, masakit siya, but nare-relieve yung pain pag nilagyan mo ng warm compress. Oo, yun namang wind, painful obstruction syndrome, wind P syndrome, wind P, ang ibig sabihin, milipat-lipat yung pain. Milipat-lipat, migratory tawag doon. And when you have dampness, damp B, ibig sabihin, merong heaviness, may swelling. Okay? So yun. At saka kung meron kang mga inflammation, yun. That's P. So, ganun pa rin, you will only get to appreciate it if, sige, we'll give, I'll expose you to P syndrome already as early as module 2.
Thank you, sir.
Thank you then for the question. Any other thing? Okay, Ma'am Lynn, are you? Ngayon ko lang yata nakita si Ma'am Lynn.
Ano po, Doc? Wala kasing camera yung gamit kong dati. Tsaka
Okay.
wala.
Okay. Naka-catch up po kayo. Sana tuloy-tuloy ha, tuloy-tuloy natin kahit ano. Ang gusto ko quality eh. How are we doing so far, Ma'am Lynn? Do you like the program?
Mas na-appreciate ko siya kasi nung nag-aral ako dati, diretso lang ng middling eh. Wala masyado. Kaya parang hindi ako nakontento.
Okay.
Kasi syempre, paano ka mag-diagnose kung hindi mo naintindihan?
Totoo. Ay, by the way ha, next week, we will also study yung reinforcing, yung thinking, yung mga techniques, no? Yun. Iuulitin natin yon, and also how to do treatment, mga points. Ang dami-daming Maraming salamat po, Ma'am Lynn. It's good na na-appreciate niyo yung aming program. Sa lamp lang po yan. Yabang.
Interested din talaga ako dun sa tongue diagnosis. And
ay nako, you will love it because that was the area where I am not good at. In fact, every time dyan na naman si kaya pala De La Cruz yung apelyido, kaya puro dila yung alam. At sige, sabi ko sila. So yun, I just ignored it, but I think ang na-amaze yung mga tao sa Occidental Mindoro, no? Especially the nurses. Is it true, Sir June, that they were amazed at how good you are at looking? Sa totoo lang, madali lang naman yung tongue if you really know what you're looking for. No?
Yes po, na-amaze po sila. Sabi nila, gusto nila kasi nagugulat sila eh.
Di bale, the whole 10 weeks may tongue. Pero ang parang hindi boring, aside from tongue, mayroon tayong aaraling iba. We want to incorporate, ano pa ba? Ang dami pa eh. Ear diagnosis, face diagnosis.
Doctor, wala bang cheat sheet dun sa tongue? Yung bang parang may magic guide kami para mas madali siya?
Meron, ang dami kong cheat sheet.
Parang naka-matrix na, Doc.
Yun, gusto ko yun, Doctor.
Ang dami, no? In fact, if you have all those cheat sheets, you will really not forget lump. Okay. So yun, sino pa ba? Ma'am Angel, how are you doing? Mas nag-improve ba yung ano mo, appreciation mo for Acu?
Opo, Doc. Mas ano po,
Na-correct nyo na
mas
ba yung
maganda.
ano mo, yung mental, yung issues mo?
Okay naman, Doc. Mas happy naman ngayon eh.
Pagaan na. Yeah. Pero yung boses mo matamlay pa rin. Sana lumakas yan next time. No?
Napagod, Doc, kasi marami ring pasyente eh.
Ay, wow. O sige na, kailangan na tayo matapos. Okay, sino pa ba? Si Ma'am, Miss Okada, Ma'am Darlene. How is Okada?
Hi, Doc. Good evening, classmates. Good evening, Doc. Mabuti naman po, Doc. Medyo, nag-busy lang in the last 2 weeks. Bali, hindi po ako naka-attend ng week 8. Pero nagbabasa lang po. May tinapos lang po akong exam on my other class po. Pero
you can catch up naman eh.
Nagka-catch up po ako right now.
Yeah, mag-commit po kayo sa diagnostics. Nilagay ko na yung buong kaluluwa ko doon.
Yes, Doc. Ngayon po, Doc, yung ang mini-memorize ko kasi I feel na kailangan ko talagang i-memorize yung transporting points po. Nasa transporting points na po.
The 5 shoe points.
Opo.
Hindi ba na kailangan memorizing yung mga dapat alam mo lang talaga yung magpaturo kayo kay Sir Leo. Memorize na niya yung 60 points.
Alam din niya yan. Magaling yan.
Magaling yan, grabe.
Mas magaling si Sir Mike sa akin, Sir.
Okay, tanungin naman natin si Ma'am SP.
Ayun pa isang magaling, Sir. Yan ang manalo. Yan ang tunay na runaway.
Makatawa mo, gusto naman to siya.
Actually, I don't expect all of you to apply what you have learned. Pero ganun lang sana, 'di ba? Hindi naman once nyo lang titingnan yung pasyente, 'di ba? So pag kunan nyo na yung picture ng tongue, yung ear, right and left, don't forget the sublingual veins, and aralin nyo, no?
Done, sir, done.
Yeah, so that the next time saka huwag niyong kalimutan yung pulse. Kasi kung mabilis yung pulse, kahit pinahinga mo na siya ng 10 minutes, talagang heat yan. May heat. And there are 2 types of heat. We have empty heat and full heat. Okay? So yun. You have to know the difference. Okay. Thank you po. So far, mukhang nag-enjoy naman kayo, Ma'am SP. Sino pa ba?
Yes, Doc. Thank you, Doc.
Sir AK. Si Sir AK hindi ko natatanungin. Mukhang inaantok na pero I'm sure happy siya. Mukhang nag-level up. No? Okay.
Challenging, no? Challenging.
And of course, si Dr. Sam na mukhang hindi niya napapagod. I'm sure ang dami na niyang pasyente ngayon. No?
Meron, Doc. Ang iba din-decline ko muna gawa nung masyadong busy sa production.
Okay.
Nire-reschedule ko.
Diba nagdi-decline o diba? Yun. So go. Sino pa ba hindi? Si Ma'am Ami, kumusta po? Happy pa?
Okay, happy, Doc.
Wow.
Kasi na-apply ko po, Doc, yung mga dating hindi ko pa na-try na mga points. So talagang nakita ko, lalo na sa stomach channel, talagang nakita ko yung napaka-super effective, Doc.
Yeah.
Lalo sa family po. Na-apply po sa family. Sa sarili din.
Kitang-kita naman sa mukha ni Ma'am Ami eh. Thank you po.
Thank you po, Doc.
Sino pa ba? Mukhang wala na yata. O sige, tapos na. Yung iba nagsiuwian na. But anyway, thank you very much everyone. And I'll see you again next Friday. Enjoy your weekend. Huwag kalimutan na
magpa-doctor.
Thank you, Doc.
Thank you, Doc.
Thank you very much, everyone. Good night po.
Good night, everyone.
Thank you, Doc.
See you next
Bye,
Friday.
Doc. Bye.
Bye.
Bye po.
Grabe, Sudaw!
Pala kayo.
Bye.
Grabe naman yan!
Okay, sige po. Bye-bye.
Madaya.
Bye,
Sama-sama.
Michael.
I-end ko na.